Good evening, I'm Katerina Georgieva. Here's what's making news right now.
This year, starting out in 2022, we've been laid off now 4 weeks. And we're just waiting on the word on Friday whether or not we're going to be laid off for another week.
It's been more challenging than usual. Our staff have definitely been stretched to the limit with our staff, unfortunately, and volunteers, and some of our guests too coming down with COVID.
The challenges that we're experiencing today hasn't happened overnight, nor has it been created or caused by the COVID pandemic. It's been exacerbated, certainly magnified, the challenge.
Thanks for joining us. Vehicle production in Canada was the lowest last year, the lowest since 1967. Automakers turned out only 1.1 million cars and pickup trucks. That's 300,000 less than the year before that. An automotive consulting firm is blaming the global microchip shortage and the pandemic. For auto workers in Windsor, it's resulted in unwanted downtime as plants sit idle, sometimes for weeks. Dale Molnar has more on the story.
JP Lefebvre works at Syncreon Automotive Canada. The plant is a supplier to the Windsor assembly plant. His plant goes down when the minivan plant goes down, so he only worked 25 weeks last year and none this year. When the second shift gets cut at the assembly plant, he will lose his job. He's worried about how all this downtime will affect his employment insurance eligibility this year.
So I was hoping that this year I'd be able to capture as many weeks as I could before that shift gets cut. Now, is it going to get cut in the spring like they say it's going to? I don't know. When the third shift was cut, it took about a year, a little bit over a year, for it to actually go away. I can't bank on that.
The lower vehicle production means less time on the line. And that's a problem facing thousands of workers in Windsor. One of Lefebvre's co-workers, who is also a union rep, is lobbying the federal government to make it easier for workers to qualify for benefits and for the benefits to increase and last longer.
Help out all the residents in this area. And it's not just, like I said, just the automotive industry. It's also our hospitality, our transportation, the casino, prime example. We're all hurting.
Kennedy has been off work 51 weeks of the past 2 years. The dramatic drop in auto production figures comes as no surprise to him or anyone in the business, considering the downtime. Automotive journalist Kay Lane doesn't see an end to the shutdowns anytime soon.
This year's going to be rough. I think we need to buckle and put on our seatbelts and buckle in, because yes, we're going to still see shortages. We're still going to see chip problems for the next little while. It's getting better, but we're still nowhere near normal.
Workers at the Windsor assembly plant and its feeder plants will find out tomorrow if they will be idle again next week. Dale Molnar, CBC News, Windsor.
City of Windsor staff have opened a new temporary daytime center for people experiencing homelessness. This as area shelters experience COVID-19 outbreaks. Over the last 2 weeks, roughly 25 of the 40 staff and volunteers at the downtown mission, mostly within the dining hall, tested positive for COVID-19. And because of that, the mission was forced to cut down on meals and only serve, quote, unhoused guests. That's so they could keep overnight beds open and staffed during the winter.
The majority of the people that are coming to us, we are able to provide a bed for at night, but there are some individuals who, we do have to turn away, and we have been turning away. And that was even before, this outbreak. It's just been part of our reality for the last, I would say, four months or so.
We're very closely monitoring the capacity and the availability at all of the shelters, and we meet very regularly with all the shelter providers to make sure that we're trying to mitigate those types of situations as much as possible. We don't want anybody sleeping on the streets in this cold weather.
The new daytime warming center opened last week is located at the Downtown Aquatic Center, but it's only there until Sunday. The Salvation Army and the Welcome Center shelter have also experienced COVID outbreaks among staff and among people who use their services. The city's Isolation and Recovery Center for those experiencing homelessness has also been at capacity over the last few weeks. The team at Hotel Dieu Grace is working on a plan to deal with significant staffing shortages. Many are sick or burnt out. Right now, the short-term strategy is to regularly redeploy staff to other areas of the hospital based on who can come to work. But in the long term, the hospital hopes to recruit more staff and restructure how they give care. The hospital CEO explains this problem wasn't caused by the pandemic, but COVID has made it much worse.
One of the strategies we are exploring is the use of unregulated caregivers where it's appropriate. So, as you likely know, this is not a novel concept by any means, but it's really introducing the use of personal support workers, patient care, personal aid workers, personal care attendants, for example, that would work and assist nursing staff. They would be supervised by nursing staff, but they could assist with duties such as providing personal hygiene, support services, assisting with lifting or turning patients, even supervising, patient exercise routines, taking vital signs, any of those other items that don't require an RPN or an RN, but support the team in the whole philosophy of care. And, we learned through the pandemic that those supports are really incredibly valuable. We introduced, as you have covered, in fact, designated care partners. We've had families come on board and trained, and we've learned that there's a lot that can be supported through non-nursing staff to support the nurses to focus on core services.
Can you give me some numbers in terms of what exactly you're seeing right now in terms of shortages?
Well, I think as of about 3 months ago, when we first started reporting this publicly, there were about 14 or 15 positions that we couldn't fill. And it may not seem like a lot, but it certainly impacts any organization. And also we've had significant absences because of COVID. So for example, the most recent set of numbers is that we've had about 100 employees impacted by COVID. A quarter of them are still recovering at home. Many are testing to work. What we've also realized is the burnout rate, the burnout impact. Where we're seeing that impact us, Katerina, is on the sick calls. Practically every day. We have an on-call system, which is not unusual in our sector. And every morning the on-call reports come in. And in every morning there are concerns around how do we replace sick calls? Where do we reallocate staff? And regrettably, it's created this redeployment environment that we're all in now. And I say that regrettably because folks sign up for a certain job, and when they come to work, they expect to be doing the job they signed up for. But we're not able to accommodate that now all the time. So I'm not sounding an alarm bell here in the sense that we're in a complete crisis. I'm not trying to be an alarmist, but what I am saying is that this model is not sustainable.
What has this meant in terms of the quality of care? Like, are there any particular areas that are having a more difficult time managing with the shortages?
Well, that's an excellent question. And I can assure you and the viewers and listeners that quality of care has not been impacted. And that's just a complete tribute to our frontline staff, to our operations managers, and to our directors. It's such an all hands on deck environment. I had the opportunity to go on rounds a couple of days ago and visited a couple of nursing units. And yes, they are tired and they are very, very focused though on their patient care. So that's one area that we are not in any way slipping. Where we are concerned is the impact of the work on our staff and both the physical and mental health impact that it's going to have on them in the long term.
Mara says the report should be ready for the board by early spring and that the restructuring will not lead to anyone losing their job. Now, as of today, a slight dip in hospitalizations due to COVID-19. 103 people are currently hospitalized. That's down from 114 from the day before. 14 patients are in the ICU. But the health unit did report 3 new deaths. They were all women in their 70s and were not residents of a long-term care or retirement home. Windsor's top doc says his controversial decision to impose a temporary ban on migrant workers to the region was run by legal counsel. Earlier this month, the acting medical officer of health issued the order, but then rescinded it 2 days later. Initially, his concern was the lack of places available to isolate workers who were testing COVID positive. Today, he stressed that the health unit prioritizes the safety of foreign workers.
The health unit, on occasion, when there's peak activity, has dedicated up to half of its staff to address the health status of the migrant farm worker community. And I think that the evidence would show that that the health unit has tried to make this community a priority in trying to advance their health. The other thing that's now well recognized, but it's worth perhaps sharing, is many of the approaches that we take are in a number of different settings, meaning this. The real issue is the housing situation of members of the migrant farm worker community. And the real public health issue is the fact that in many bunkhouses, 20 people share a bathroom and a kitchen. There could be, on occasion, 6, 8 people sharing a bedroom. And these are conditions that facilitate the transmission of respiratory disease. And anytime people work and live in settings where they're sharing bathrooms and kitchens, there's increased surveillance and action by the Public Health Service.
Even though Dr. Nesaturi reversed the ban, he was still, after the fact, called out by high-level provincial officials. They called the move discriminatory against migrant workers and an overreach of power. A collision along the 401 near Chatham caused severe traffic delays today. The two-vehicle crash sent 3 people to hospital, including one person with serious injuries who was airlifted out. That's according to Ontario Provincial Police. The collision occurred at about 9:30 in the morning, shutting down parts of the highway for hours. Traffic was left near a standstill. These trucks inching along the highway near Tilbury. Officers were on scene redirecting traffic and asking motorists to avoid the area and plan alternate routes. The Cross Canada truck convoy that's making its way to Ottawa is in Ontario and passing through the Toronto area. The drivers and their supporters are protesting the federal government's vaccine mandate for cross-border truckers.
When we got our vaccines when we were kids, they were a vaccine. It was a one-time deal. It was something a lot of research went into. And now it's, to me, it's basically a flu shot. That's really all it is. It's people that are all vaccinated, they're getting sick, they're passing it on the same as anybody and everybody else, right?
The protesters want the mandatory vaccine mandate rescinded. They should start arriving in Ottawa later today. Police all along the route are warning of traffic disruptions. Officials in Ottawa are beefing up security and preparing for counter demonstrations. Both Canada and the U.S. have made vaccinations mandatory for truckers crossing the border. The Ontario Trucking Association says the regulations will not be changing and truckers will have to be vaccinated. A draft of new national standards for long-term care facilities has been released. One of the key recommendations deals with defining and protecting the right of residents to, quote, live at risk. That would, for example, balance a facility's need to protect residents with the right of individual residents to receive visitors, a problem that became very apparent during the pandemic.
It was actually very disheartening to see that we did not get the balance right between keeping residents safe from a virus and separating them from their families. The outcome in many cases was detrimental to residents.
The draft regulations have been developed by the Health Standards Organization. It's an independent, not-for-profit organization that develops standards and assessment programs for the health and social services sectors. The regulations are intended to give long-term care residents more control over their lives by giving them a greater say in daily care decisions and visitor policies. They direct long-term care homes to plan meaningful daily activities and facilitate social connections between residents both inside and outside of facilities. The Prime Minister has gone into isolation after being exposed to COVID-19. It's not the first time this has happened. He was exposed to COVID back in 2020 when his wife, Sophie Gregoire, contracted the virus on a trip to England. In a tweet this morning, he said, quote, "Last night, I learned that I have been exposed to COVID-19. My rapid test result was negative. I'm following health rules and isolating for 5 days. I feel fine and will be working from home. Stay safe, everyone, and please get vaccinated." England has lifted most of its COVID-19 public health measures. As of today, masks are no longer mandatory and vaccine passports have been shelved. But the mask mandate remains in place in Scotland, Wales, and Northern Ireland. CBC's Thomas Daigle has more from London.
Well, people here in England are no longer legally required to wear a mask in stores when they're out and about. And even if they're going to a nightclub, a concert, in a big theater, at a stadium, they're no longer required to show their COVID pass, which was a proof of vaccination or a proof of a negative COVID test. That has all been done away with as the British government tries to tell people here that it's time to learn to live with COVID. Certain supermarket chains are telling people here, please continue to wear your mask inside. And indeed, TfL, Transport for London, the public transit operator here, is telling people if you're taking the tube or the bus, please continue to wear a face covering.
No, of course, on the train, on the underground, I think, for the next few months, yeah, for sure, just to be safe in the supermarkets as well. So, yeah, I will do, yes.
I will be wearing a mask on the train, yeah. So I've decided that, for the moment, with the numbers of cases, I would still rather protect myself and everyone else.
Now, some small business owners have complained that this is going to be awkward for them because they'll have customers coming in maskless, indoors, in close quarters, and it'll be up to the business owners and staff to tell those people to continue to wear their mask, even though it's not legally required anymore, and that can be difficult for staff.
At the moment, we feel that it is better to stick with wearing the masks, and we want people to come in and have their hair done feeling comfortable that we are still taking precautions, because it's a mixture of how people feel at the moment. Some people feel very comfortable sitting there without a mask, but some people still don't.
Upwards of 100,000 people across the UK are still coming down with COVID every day. Britain is still recording upwards of 300 COVID-related deaths per day. Remember, England tried to do this. They did away with almost every COVID restriction last year, only to reimpose masking temporarily a few months later. Thomas Daigle, CBC News, London.
The Canada Revenue Agency is sending out a new round of letters to those who got federal emergency aid to help them through pandemic lockdowns. It's the second time the agency is mailing thousands of recipients of the Canada Emergency Response Benefit. The CRA is verifying the eligibility of the millions of Canadians who received the $500 a week CERB benefit. The letters will target those whose tax filings suggest they may have earned more than the $1,000 a month allowed outside of the CERB checks. The letters say the CRA will work on flexible repayment plans, but it warns that won't be the case for those who don't respond. Let's take a live look outside there. We've got more snow on the way if you've been enjoying the winter wonderland we've had over the last little while. We do have a sunny day to look forward to on Saturday as well. Nick Cirkovich, he'll be here after the break and he'll give us a full weather breakdown. Stay with us. Nick Sirkovich joins us now for a look at our weather forecast. Nick, it's really, really cold, and it's going to stay really, really cold, isn't it?
I was going to say it's going to get even colder. Yeah, a lot of people telling me today, oh man, it's so cold outside. I'm like, just wait till tonight.
Yeah, just you wait.
Yeah,
you don't even know.
Exactly. No, you don't. It is actually getting a lot colder. Unusually cold, actually. -4 degrees out towards Sarnia, -3 in Windsor right now, -7 out toward Kitchener-Waterloo. Winds, though, when you factor them in, we're looking at wind chills generally in or close to the minus double digits. It's going to get much colder, feel much colder than that. Coming up, though, over the next couple of days. What we're looking at is a cold front that's going to move through. Now, we've seen on and off light flurries right across the region, more so out toward the London area. We'll see some snow squalls likely develop in that area. But for Windsor, a few flurries here and there. That's really about it. Now, on the bigger picture, you see you've got sort of the cloud cover up toward upper Michigan, and then in behind it, it clears out. This whole system is sweeping through, and that's with a cold front. It's going to drag down temperatures come tonight. So through tonight and into tomorrow morning, we're looking at clearing sky cover. Still the risk of a few flurries here and there, so not a straight sunny day. But generally speaking, we'll see a mix of sun and cloud, the risk of a few flurries, and then it begins to clear out through the evening. But this is all coming with colder weather. As that front sweeps through tonight, we're going to see the winds shifting and dragging in some of that colder Arctic air. Sunshine, by the way, continues through at least the first half of the weekend. Here's the winds that I was talking about. So you notice how we're out of the southwest, and then through the overnight they shift out of the north. They don't really die off too much, though. So the problem with that is we're going to see the temperatures dropping, but we'll still see the winds in the neighborhood of 20 to 30 kilometers per hour, and that's going to make the wind chills feel rather cold. Tonight, there's a look at your overnight lows after the front passes through. Wind chills, even in Windsor, of about -20. Tomorrow, we're looking at highs of -9. Wind chills around -20. A little better in Windsor, but generally around -20. Let's say -18 to -20. Same story into Saturday as well. And look at this overnight low. Friday into Saturday, -18. Saturday into Sunday, -16. A few flurries on Sunday. We do get a warm up into next week, but you got to wait till Tuesday for that to come.
A warm up, a warm up. I like the sound of that.
-18 through the overnights. Like, this is really cold stuff.
All right.
Yeah.
Thanks so much for that, Nick.
You bet.
When we come back, we've got an update for you on the lead up to the Olympics. Stay with us. Members of Team Canada have arrived in Beijing. Major COVID safety precautions are in place at the airport. Workers outfitted in full PPE gear are screening all new arrivals. The Canadian contingent arrived on a chartered flight that took off from Vancouver yesterday. It also included CBC's team of journalists who will bring you full coverage of the games. Opening ceremonies are next week, Friday. There's a small fish that's still making a splash in a very big pond. Smelt remains a favorite in many parts of Atlantic Canada. While the pandemic has put traditional community smelt fries on hold, harvesting of the fish continues, and it hasn't changed much over the years.
A smelt is a delicate, tasty little critter. Fish that we have here in many of the maritime provinces, but here in Miramichi Bay, it's a delicacy. It's one of our mainstays in our community. Back in the older days, all our forefathers had to go out in the ice and fish them. They didn't have the power saws or the the fancy equipment that we have today. Like today we have snowmobiles and power saws to help us set nets, where before they had to do it all by hand. They used to come up by horses. It's really a dying breed. There's not too many young fellas now want to take it up because you're out in the elements so much, and really there's not as good a dollar value as in the other species. And we'll saw out the holes, get the net all ready, and we'll close up the net. And the nets are 50 feet long, 14 feet wide, and they go anywhere from 4 feet deep to 12 feet deep. So when we go to fish it, we close the net and we haul it 25 feet of web out, and in the end, that's where we get our bounty from the sea. Hopefully it's a good catch. Some days it's better than others. And but we got to take the good with the bad. Ain't good in that end, eh? Nope. Right now we have 20 nets on the water, and we have to fish those every 3 days. We try to average 1,000 pounds a day. That's a ballpark number. That's what we got to make to cover our expenses. And then we do that. It takes till 4 or 5 o'clock every day. And then we got to get ready for the next day. You know, we got to take the fish to the fish plant. We got to repair any power saws that are broken, and get in the house where it's nice and warm. Put the furnace fires on and have a good hearty supper.
That's it for CBC Windsor News. Thanks so much for watching. Have a great night.